Hello all and welcome to the Digital Health and Wearable series. Another fantastic episode, and today we have another fantastic guest. So I'm delighted to have you here. Before we go ahead and introduce our guest, I'd like to just acknowledge our sponsors, our global partner, Spirit Digital. All the partners will be on after the video, so please check them out. Some really interesting innovators and partners we work with. But without further ado, Nick, very welcome. Nice to see you. We have Nick Adkins today. So how are you, Nick? Hey, Nick.
I'm well, bro. Good to see you.
So delighted to be here with you. It's fantastic to see you. I haven't seen you for quite a while. How are you
I know
keeping?
the last time I saw you was in Berlin.
Yeah, we were
You
in Germany.
saved me from a taxi driver.
Yeah,
You remember that?
I remember that. By the way, Nick Adkins does a fantastic work around the world. He's a co-founder of the PinkSocks Life, which you will tell us all about it. Very warm welcome, Nick. Nice to see you. Tell us a bit more about the PinkSocks movement, how we started, and for those in healthcare don't know about it.
Yeah. Oh, well, that's good. So the PinkSocks movement now is a 501c3 nonprofit organization here based in the United States. We're a global movement of for at this point over 100,000 people all around the world in just about every country that you can imagine. Just a bunch of happy, smiley people that believe in love and kindness and connection and empathy and just really being nice to each other. But how it all started was in 2015. In April of that year, I went to a healthcare conference in Chicago, and Andrew Richards, who's the co-founder of PinkSocks, he and I went, and we had our little backpacks, and we pulled them up with pink socks. I guess I should have had some pink socks here on camera, but you probably, here's the pair right here. You've probably seen a pair of these socks around that look like this, right? We started giving away these socks, and we had no idea that giving away some pink socks, that gifting pink socks would become a thing, all these years later. And so like I said, that was 2015. In 2019, last year, PinkSocks Life Incorporated became a 501c3 nonprofit charitable organization. We put some structure around it. We've been doing all kinds of good things, not just in healthcare. We've started in healthcare, but kind of jumped out, and we help support missions that are doing all kinds of kind things around the world, whether it's helping feed hungry children or helping homeless people get supplies. We're doing this thing that's really cool. We started last year where we go into schools, elementary schools, young kids, kindergarten through 5th grade type thing, and in middle school now, but where the teachers use PinkSocks as part of a teaching curriculum to help them teach the children about kindness and inclusion and not bully each other. And they have these kindness pep rallies, and you've got all these happy, smiley kids giving each other their pink socks and bouncing around. And then, once a week, the teachers teach a class about kindness, and all the kids wear their socks back to school again. It's really been fun, and continues to be fun to see how this grows. And, really, what's it all about? It's really, like on the hoodie says, love more, right? So that's really the message, is we're just a bunch of happy, smiley people like you, who are spreading love and kindness around the world every day. And, that message really never gets old. It's very needed. It's always needed, not just now, but all the time. And it's like I say, just fun to watch. I get up every morning on Twitter and search the hashtag PinkSocks, one word, plural, always, and see what people are doing all around the world, and help celebrate them and all the kind things they're doing and all the good things they're doing. And it's just fun. And I know, João, you've been part of the PinkSocks tribe now for for a few years, so you know how this works, and you know, like me, a lot of those people in real life that are doing good things. You know, a lot of times it's with technology that they're building, services they're providing in the healthcare space. Just fun to watch. So that's kind of the long version of PinkSocks and where we are now.
Wow. Well, what can I say? I mean, fantastic work. You know, I've been following you for quite some time, and I love the movement. And wow, 100,000 community. That's really, really big. And we've been in a few conferences together. And what you share is very powerful. The love more. And when you experience that, you give some magnificent hugs, by the way. I experienced a few, and everybody is very like surprised in a nice way. How can like a warm, firm hug really move us and connect us and everything? So, congratulations for the fantastic work. What I would like, you already shared a few values, Nick, but tell me a bit more about the values, your mission, goals, and this magnificent contribution that we are adding to humanity, much needed by the way at the moment.
Right. Yeah. You know, Joe, I really miss the hugs. And when we get together in real life, and the PinkSocks tribe, and whatever community you're in, whatever city, people get together and they have these meetups, right? And so right now, during the pandemic, we haven't been able to do that. So everybody's trying to stay home and wear a mask, and we have PinkSocks mask. If you need a mask, I'll send you one. So the hugs we kind of miss. But we have virtual hugs. We're having a hug fest tomorrow online. I hope you can join us. It's tomorrow at 11:30 Eastern, 11:30 a.m. Eastern. Hope you can join us. The information's on Twitter. I'll send it to you after this. But we have these virtual hugs because really, this. I mean, we and you know it more than me because your head's down all the time on wearables and digital technology. There's plenty of connectivity, right, in the world. We're swimming in connectivity. We're almost drowning in connectivity. We're so connected. But what's missing is authentic connection. Yeah, like right now, it's good to see you. Yeah, we're connecting, even though it's over video. We're having a connection here. This is good.
Oh, brilliant.
That's what PinkSocks really helps promote, right? That's this ethos of gifting. It's really all about the connection that you're going to make. And you know how this works. I mean, when you wear your PinkSocks, every day, every time you wear those, or your pin or, something that's got the mustache on it, it sparks a connection with someone. Maybe you just in a coffee shop or at the post office or on the bus, someone says, "Hey, I like those socks. Those are cool. Those are fun. Those are funky. What's the story?" That's the universe tapping you on the shoulder saying, "Okay, stop what you're doing. Let's get off your phone. Maybe stay on the bus, another stop, get off your bike and say, hey, I'm Joe. What's your name? Hey, I'm Nick. Oh, it's good to see you." Have those moments of connection. Get off your phone. Take your earbuds out. Look at each other, right? And just talk. I mean, we can't always control governments and politics, but what we can control, is how we. Hold on, that's my coffee machine right there.
Mm-hmm. It's life, Nick. It's fine.
Yeah, I know. It's my coffee machine's over there rinsing itself. Okay. What we can control, though, is how we interact with each other, one person at a time. One smile at a time, one pair of PinkSocks at a time. If your PinkSocks will help you spark a connection like that, let them. And that's the thing that we do, right? That is our ethos. The gift of gifting PinkSocks to someone, it's not really about the socks. It's about this right here. It's about you smiling and me smiling and realizing that we're all in this together, that it's going to be okay. Yeah. And man, how important is that right now? I mean, the months that we've gone through with this pandemic, and the months that we still have to go before we're back out there traveling and doing all the things and hugging in real life again. Yeah. But it's all going to be okay because we're in this together. And that's really at the heart of the PinkSocks movement, this ethos of gifting and connection and inclusion, and just an overall sense of we're going to be okay. We're all in this together. And I see that smile on your face right now because you know it to be true. You live it, and it's good to see you every day. So thank you.
No, thank you, Nick. Thanks for what you shared. What you shared is actually very powerful. You know, I have a few pairs of PinkSocks, and I have experienced several things, but I have experienced firsthand receiving them. I have experienced giving them away. And also, what you mentioned is really powerful about is an excuse to talk and connect with another human being, whether there is in a shop, whether they are in healthcare or not in healthcare. So I actually experienced these things that you mentioned, and there's a powerful connection. And sometimes it's very easy to forget that, because we're busy on our phone, on Twitter, or doing what we do. So yeah, thanks for reminding me of that. And I love the top and that love more, and it's much needed. What I want to ask you too, because we talk about healthcare and we connected in healthcare. What do you think, Nick, the healthcare industry needs the most in general and perhaps right now?
Oh man, I think what we need the most is we've got to let go of this us versus them way of thinking. That there's, hospitals, doctors, nurses, patients, families. That there's somehow that, in insurance companies, payers. That all of these things are, individual silos or different teams that that are sometimes pitted against each other, and comes into the moment with some adversarial relationship, where that's not really the case. Patients are people. We're, doctors and nurses and administrators, we're all people. We're all the same. It's doctors and nurses and techs and everybody on the care team in the hospital, the whole staff. Their job there is to help you. That's what they're there for. That's what they show up every day for. Man, and they're showing up right now, putting their lives at risk, and so, through the years, I'm going to these conferences and you just hear this so much negative energy around, this blowback on hospitals, and this specifically, I'm really focusing here on the U.S. market. I'm not saying this is, because I've traveled to other countries and don't have this problem, but here, we've got this thing going where it's us versus them. It's the patient, the family versus the doctor in the hospital. No, man, we got to get this thing where we're all lined up saying, this is going to work because we're on the same team. And how that's going to work over here for us is, and so much of this is driven by fear, fear of, oh my goodness, am I going to survive? Oh, how am I going to pay for this? Because here in the U.S., universal coverage isn't a reality yet. And so a lot of people have to worry about the financials of just, getting sick can be financially disastrous. People here, unfortunately, lose their homes. They go bankrupt trying to pay their medical bills. It's just, yeah. And a lot of that fear drives this, and that's got to go away. And for us here, the number one thing in the U.S. is for healthcare is we have we have to agree that healthcare is a human right. That it's not just something that the people that can afford it get. And so my hope, very quickly in the coming year, with the new administration here politically, that maybe it's way past time for the country to begin some real healing around how we can care for each other. Yeah.
Well,
That's my biggest wish for 2021, besides everyone getting the vaccine and us not having to worry about the pandemic anymore, is that we can just let go of some of our politics and come meet in the middle as close as we can, so that we move forward together. So I believe we're going to do that.
yeah, sure. I really understand that kind of added pressure, healthcare, one more financial pressure and burden on the top of everything else in life. The house, the food, the petrol, the insurance, everything else. So it's another worry. It's been fascinating talking to you. What I want to finish off kind of the discussion. I'll talk to you for hours, to be honest. But right now with the COVID, the human connection has been compromised. What do you think? We already shared the hugs, the values, the connection, the human connection. But what do you think we can do to recover, to restore, and unite humanity again? And some of the things that you mentioned there is about uniting people. What do you think we can do, Nick?
Well, I think what we can do is if you haven't already started this, and start it today, is be very grateful for every day. If you wake up into gratitude for your now, right now, that you're healthy, that your family's healthy, right? That you have a place to live. Just be grateful. That gratitude will infiltrate your life and impact how you relate with every moment of every day and how you interact with people around you. This attitude of gratitude from your heart that will allow you to see people around you as like you and not so much different from you. The reality is we're all so similar. We're all so the same. We're not different. And I think there's so many lessons that we're learning through this pandemic. Whether it's patience, it's learning to love ourselves more, love our family more, love the planet more, appreciate the things we have, be grateful. I mean, there's so many things that this is, that we can look at this and say, okay, we've learned the lesson. Can we move forward with this and treat each other kinder? And I think that's what's happening. And I mean, think of all of the stories, Joe, of all the people who are sick, people who have died, right? I mean, at this point, there are no degrees of separation. We all know someone.
Mm.
We all know someone who has this, and we all know someone in the first circle who's died from this. And so the lesson of empathy that we're getting, that feeling of connectedness, that wow, we have to be kind to each other. That's how we get through this. So the biggest lesson for me is just that, on when we get the green light, when everybody's got the vaccine and we feel like we're ahead of this thing, and we can travel again, get back out there and start seeing each other in real life. Oh man, if I was grateful for the hugs in the past, and sharing space with people like you and all of our friends. And just, man, I was grateful then. I'm going to be super grateful, right, in a few months. And I know you are too, for us just to get back out there and enjoy each other's company, sharing space with each other. We've just got a little bit longer to go on this thing. We've made the turn on this. I mean, today is the solstice, right? So this is the winter solstice, December 21st. So this is our longest day, and tomorrow we start to turn back toward the light, right? And that's true in our lives right now. We've made the turn on this thing. It's been a long season, but I'm very grateful that we're heading back toward the light now. And I have no doubt that in 2021 we'll be seeing each other in real life again. Yeah, that makes me grateful. That makes me happy.
Nick, thank you so much for remind me and sharing that. I'm looking forward to get back to the world again. But look, it's been fascinating talking to you. To finish off very, very quickly, I know that you're not the person for show off or anything like that, but I want to finish my episodes with a 1 minute of fame, which I know is a surprise for you. I'd like you to just acknowledge something, a personal achievement, professionally, a shout out to the world. You can talk about family, anything that you wish. So to round up this magnificent episode, a minute of fame, and then we conclude. Over to you.
Okay, so you a minute of about me or someone else?
And anything that you wish. It could be a personal achievement, a shout out to a company, a person, a professional achievement, a personal achievement, anything that you wish.
Okay, well, man, that's a tough one. I say from a personal achievement during this time, I've been playing a lot of guitar. I've played guitar for pretty much my whole life, but this has allowed me, since I'm home all the time, to play guitar every day, multiple times during the day. So I'm grateful that my guitar skills have leveled up during this time. I've been having fun with that. I guess from a professional standpoint, I'd like to give a shout out to, and specifically since you are the wearables expert and this is your show, I want to give a shout out to my friend Dave Rabin at Apollo Neuroscience, Dr. Rabin. They've created some very cool technology. Again, I probably should have been wearing it right now, but it's upstairs in the bedroom. I use it to help me relax at the end of the day or before I go to sleep. But it's a wearable device. It's neurotech. You can wear it on your wrist or you can wear it on your ankle, and it basically helps you relax using pulses of vibrations that correspond with brain waves. Helps you lower your resting heart rate. It's really fantastic. Apollo Neuroscience. It's a fascinating neurotech in a wearable device, and super cool guy outside of that too. So anyway, shout out to Dave and Apollo. So you'll be seeing more of that if you haven't seen it already. So it's cool stuff. I think it's there's a lot of cool wearable stuff out there, as you know, but for me, that's kind of that one's on the top of the list right now.
Brilliant. Well, Nick, thank you so much for your time. Nice to see you.
Well, it's good to see you.
Everybody, please check out the Polo, the wearable, and also share the channel with all your friends and communities in healthcare. Next week, we'll have another fantastic guest for you, and I'm looking forward to welcome you again every week. So until then, I'll see you soon.
All right. Happy New Year.
Happy New Year.
All right, brother.
Bye, Nick. Bye, Nick.
Okay. Bye.